In this module, we're going to talk about carbohydrates in health and disease. There's a lot to discuss, so I may move fairly quickly, but you can follow up in your chapter. We're going to talk about diabetes and explain its health consequences. And we're going to describe how carbohydrates contribute to the development of dental caries or cavities. We're going to talk about the role of carbohydrates in weight control, and I'm going to explain to you how fiber may help promote health. So what is diabetes mellitus? I've been referring to it quite a lot in this chapter. What it's characterized is by high blood glucose levels. So uncontrolled diabetes, the consequences of it are damages to the heart, blood vessels, kidneys, eyes, and nerves, and failure to manage your diabetes can lead to blindness, to amputations of limbs, toes, feet, legs, fingers, and can lead to kidney failure. So people with diabetes, there's those of us in healthcare spend a lot of time teaching people about diabetes and how to manage their diabetes. Here is a picture on the right. It talks about the blood glucose levels in diabetes. So we've talked a lot about normal levels. So normal in the blue, fasting is less than 100, or 2 hours after a meal is less than 40. Pre-diabetes, now a major focus for healthcare practitioners is for those people with a blood glucose level for fasting between 100 and 125, and 2 hours after a meal between 140 and 199. Diabetes is characterized as a fasting blood glucose greater than 126, and 2 hours after a meal greater than 200. And what is the incidence of diabetes? There are two types, type 1 and type 2. This is a graph explaining type 1 and type 2 diabetes in adolescents. The purpose of this is it compares the number of cases of type 1 and type 2 diabetes diagnosed per year in children ages 10 to 19 by race and ethnicity. So about 20 years ago, type 2 diabetes was rare in this age group, but as in adults, the incidence is rising, especially in certain minority groups. So a major focus in community health is reducing type 2 diabetes in minority groups, and that requires some cultural sensitivity strategies to modify diet and lifestyles. So which population group has the highest incidence of adolescent type 2 diabetes? Can you tell here? And we're seeing here a Native American. Let's talk a little bit more about the different types of diabetes. So type 1 diabetes, it's an autoimmune disease. Typically the insulin secreting cells in the pancreas are destroyed, and only about 5 to 10% of all diabetes cases are type 1. Typically or usually develops before the age of 30, and these people don't produce insulin. That's why they do require insulin injections, or they may have an insulin pump. You may have seen someone with that. The challenges with type 1 diabetes is low insulin can increase their risk for ketone formation, and we discussed that the blood becomes acidic, and these people are at very high risk of diabetic ketoacidosis. And I have seen more often than I'd like to say, working in the ICU, coma or death for people with type 1 diabetes, even type 2 undiagnosed and diabetic ketoacidosis. Type 2 diabetes, that's the more common type. 90 to 95% of all cases of diabetes fall in this category. It usually begins with that pre-diabetes. You saw those mildly elevated blood glucose numbers. It usually occurs in adulthood, but it can occur at any age. Actually, a young man at my son's 6th grade class told my son that he had type 2 diabetes. And this is when the cells in our body lose the sensitivity to the insulin that we're producing, and they become insulin resistant. And certain cells are more insulin resistant than others. For example, fat cells are very insulin resistant. So if someone carries their weight around their abdomen and they have a lot of fat cells in their abdomen, those cells are insulin resistant. And so the amount of insulin they make may be adequate for someone that doesn't have those extra cells. But because they have all these extra insulin resistant cells, they don't use their cells more efficiently. And also the cells may begin to make less insulin. But type 2 diabetes is typically treated with diet and lifestyle changes. That is the first approach to type 2 diabetes. Gestational diabetes, you may have heard of that or know someone with that, and that is diabetes that typically only occurs when someone is pregnant. This can result in a baby that is typically weighs more or is larger than its gestational age, so that results in heavy babies because there's so much sugar in the blood that the baby actually gains weight in utero. It resolves after pregnancy, which is nice. So the woman has their baby and the diabetes is over. But it does, women with gestational diabetes are at increased risk of type 2 diabetes later in life. And while they have this diabetes during pregnancy, they really have to watch their diet and follow a specific diet. They're typically seen by a dietitian to explain the very specific diet that they need to follow. What are some symptoms? How do you know if you have diabetes? Well, early symptoms of undiagnosed diabetes is frequent urination, excessive thirst, blurred vision, weight loss, and rapid weight loss in a short amount of time. And that's typically what sends someone to the doctor or the ER or the urgent care with these symptoms, saying, what's wrong with me? And diabetes is diagnosed. Again, the long-term complications of uncontrolled diabetes are damage to the heart, blood vessels, kidneys, and nerves. Here's a great example of complication: increased risk of stroke, high blood pressure, blocked arteries and nerve damage, nerve numbness, reduced blood flow, slow healing, infections leading to amputations in the legs, feet, and toes. I could talk for probably hours on the complications of diabetes and the management of it, but this is just a brief synopsis. How do we manage it? We like to manage it by diet, avoiding too many simple sugars, more complex carbohydrates, more balanced meals with a managed glucose load throughout the day. Exercise helps us use up that excess glucose in our body. Checking our blood glucose regularly to make sure that it is not too high. And sometimes we do have to treat it with medications, either oral medications or insulin injections. Hypoglycemia, what's that? This can be caused by too much insulin, excessive exercise, or inadequate food intake. It's an abnormality, possibly an insulin production, or how our body responds to insulin. In healthy, it's typically treated by small, frequent meals, more fiber-rich food versus that high simple sugars and adequate protein intake. Dental caries. Too much sugar, simple sugars, causes cavities. For all you dental hygiene students in the course, the bacteria in the mouth digest carbohydrates and produce an acid which damages tooth enamel. Causes of dental caries can be frequent snacking, consuming foods that stick to the teeth, sucking on hard candy, or sipping sugary sodas all day. Weight management. There's an increased popularity of low-carb diets, and carbs have got a reputation for being fattening. But it's really now what you know is the type of carbohydrate consumed is really important. Diets high in simple carbohydrates don't provide the satiety, and they add a lot of empty calories to the diet. And they cause that rapid rise in blood glucose that stimulates the release of insulin, which may promote fat storage. And these simple sugars can be addicting and lead to constant cravings. So diets high in unrefined carbohydrates help with weight management. They add bulk to a meal, they slow digestion, they increase our feeling of satiety and fullness, and they allow you to feel full with less food. So we know that you don't want to eliminate carbs from the diet. Very bad idea, can cause ketosis, but we want to eat more complex carbohydrates to help us feel full and that which are more nutritious. So what's the story with this picture? People usually first thing they ask me is, how do I lose weight? You're a dietitian. And what I say is weight management comes with reducing the amount of simple carbohydrates. And one of the ways we get a lot of those is from beverages, whether it be sodas, energy drinks, sports drinks, too much juice. Too many simple sugars in the beverages we drink can lead to us gaining weight, and a great way to reduce. Little interruption there. I am a real person with kids and a family trying to record lectures. So where were we? Weight management. So what's the debate? Should you avoid high fructose corn syrup? So high fructose corn syrup is a common sweetener in sodas and fruit flavored drinks. As the use of high fructose corn syrup has increased, so have levels of obesity and related health problems. And some wonder if there's a connection there. But what research has shown is that high fructose corn syrup is chemically similar to table sugar. And though controversy exists about whether the body handles high fructose corn syrup differently than table sugar, really at this time there's insufficient scientific evidence to say that high fructose corn syrup is any less healthy than other types of sweeteners. But what we do know and what you've learned is that too much added sugar of all kinds, not just high fructose corn syrup, can contribute unwanted calories that are linked to health problems such as weight gain, type 2 diabetes, metabolic syndrome, high triglyceride levels, and all of these boost your risk of heart disease. The American Heart Association recommends that most women get no more than 100 calories a day of added sugar from any source, and that most men get no more than 150 calories a day from added sugar. So that's about 6 teaspoons of added sugar for women and 9 teaspoons for men, and we're going to talk more about this. And if you're concerned about your health, smart to play is to just cut back on added sugar, regardless of the type. Non-nutritive sweeteners, we know they replace added sugars in the diet. The pros is they decrease dental caries, control blood sugar. Cons is they're associated with weight gain because people think sugar-free, they can eat more, and there's still a lot of calories in it. They're in very low nutrient density foods and toxic at very high doses. Go ahead and review the tables on your own, and you can learn a little bit about all the different sugars. Heart disease, high sugar diets are associated with increased blood lipids. High fiber diets help lower our risk of heart disease. Soluble fiber binds the cholesterol and gets it out of our system. Bowel Health. High fiber diets help with constipation, reduce hemorrhoids, fight colon cancer. And this is a picture of diverticulosis, and it can benefit from a high fiber diet.